Wet distemperament has some common signs and symptoms with cold distemperament. Like cold distemperament, the digestion in wet distemperament is weak too. We have more production of phlegm. We have loosening of joints and sometimes recurrent dislocation of joints. We have loosening in all of the tissues of the body, not only because of more production of the phlegm, but also because that wetness is defined by more flexibility and more softness. We have more production of saliva in the mouth, a mouth full of saliva, and sometimes drooling of saliva because of loosening of the muscle that hold the saliva. We have hanging cheeks because of looseness of the body. We have loose stool. We have more need to sleep. A patient with wet distemperament is a sleepy patient, and this sleepiness will become more if cold distemperament add to this wet distemperament. If warm distemperament add to this wet distemperament, the sleepy will be like napping in during the day, short but frequent napping, because warmness try to awake patient but wetness try to sleep patient. And patient with wet distemperament have a puffy eyelid that will be worsened by using wet agents. I mean, for example, bathing, using sweet waters for washing, wet airs, or wet temperamental foods. And in contrary, they have benefit from dry agent. In dry distemperament, we have a sleeplessness. The patient suffers from wakefulness, waking in the night. We have coarseness and dry skin. This skin will absorb oil or moisture very fast, rapidly. We can use it as a test. Rub some almond oil, for example, on the skin of a patient with dry distemperament and watch the speed of absorption. The patient with dry distemperament feel better in wet season, for example spring, and get worse in autumn or fall as a dry season. Also, signs of dry distemperament become worse by using dry agents, going to desert with dry air, or using astringent or salty water as dry water, or using dry temperamental foods. He or she have benefit from wet agents, sweet water, wet air, wet temperamental food.